Hello everyone. Now we are going to discuss about the RBC indices. So what are RBC indices? RBC indices are measurement that help evaluate the size, shape and quality of RBCs, and they are crucial for diagnosis of different types of anemias. So what are they? Some of the examples of RBC indices are MCV, MCH, MCSC and RDW. So now we'll cover them one by one. First is MCV, also known as mean corpuscular volume. So as the name suggests, it's a volume. It basically measures the average size of RBC. How we calculate MCV? So we calculate MCV by MCV is equal to hematocrit or PCB in percentage divided by RBC count in cells per million cells per cubic mm or microliter into 10. So the normal range for MCV is 80 to 100 femtoliter. The other RBC indices is MCH, known as mean corpuscular hemoglobin. It indicates the average amount of hemoglobin in a single cell. Average amount of hemoglobin in a single RBC. So how we calculate MCH? So MCH is calculated by hemoglobin in gram per deciliter divided by RBC count in million per microliter or cubic mm into 10. Normal range for MCH is 27 to 32 picograms. The third RBC indices or absolute value is MCHC, which stands for mean corpuscular hemoglobin concentration. So it measures concentration of hemoglobin in RBCs. How we calculate MCSC is is equal to MCH divided by MCV into 100, or hemoglobin in gram per deciliter divided by hematocrit in percentage into 100. Normal range for MCSC is 32 to 36 gram per deciliter. The other RBC indices is RDW, red cell distribution width. It basically indicates variation in RBC cell size, and it is measured by automated cell counter. Now we see the normal range for RDW is 11.5 to 14.5%. Now we'll take a exercise for how we calculate different RBC indices. Say for example, we need to calculate MCV, MCH, MCSC for following values: hemoglobin 15 gram per deciliter, hematocrit 50%, hematocrit 45%, and RBC count 5 million cells per microliter or per cubic mm. So to calculate MCV, as we know, the formula is hematocrit in percentage divided by RBC count in millions per microliter into 10. So the value of hematocrit is 45 and the value of RBC count is 5 million per cubic mm into 10. So the value is 9 into 10 is equal to 90 femtoliters. So for the following findings, MCV is 90 femtoliter. What about MCH? As we know, MCH is equal to hemoglobin per gram per deciliter divided by RBC count millions per microliter into 10. So the hemoglobin concentration here is 15 gram per deciliter, RBC count is 5 into 10, so the value is 3 into 10 is value is 30 picogram. And what about MCSC? MCSC, as we know, MCSC is MCH divided by MCV into 100. So the MCH is 30, MCV is 90 into 100, so we'll get a value of 33.3 gram per deciliter. This is how we calculate the absolute value or RBC indices, and they help us to determine the types of anemia, whether it is microcytic hypochromic or macrocytic anemia, or normocytic hypochromic or normochromic anemia. As the microcytic, macrocytic or normocytic decided on the basis of MCV, and hypochromia is decided on the basis of MCH. Thank you.